Let's now make sense of where things stand now and where we are headed with infectious disease expert, Dr. Benjamin Ko. Doc, thank you so much for joining us. You just heard Marcy Teodoro. The national government cannot even provide them with specific information they need to make a key decision of whether or not we should remain in ECQ or MECQ. Why are we now at MECQ starting tomorrow when the cases continue to rise?
Could you repeat the question, Rico? I think it's a little bit garbled from my end.
Well, you know what? Marcy Teodoro just mentioned earlier, Doctor, that the national government couldn't even provide them with specific data for them to make a decision on what classifications we should adopt starting tomorrow. So is it the right thing for the government to implement MECQ, the National Capital Region, rather than ECQ when cases continue to rise?
Well, yeah, it's kind of ironic that we move into a more lax quarantine measure compared to the original ECQ. But I guess this is something to do with the ayudas, no? Because when you stay in ECQ, it is mandated that the government provide additional monetary funds to the public. Unfortunately, and I said that already. To me, I don't think that there should be a middle ground. It's either you are in a lockdown or you are not in a lockdown. And I am not. Yeah.
Because, Doctor, there could be dire consequences if the relaxed lockdown won't work. It would be worse if we will see more lives lost than the IATF decides to shift back to ECQ.
Yeah, there will be dire consequences because what will happen when you are in MECQ is that the cases will still continue to rise. Unlike if you are, and then of course the conditions are almost the same as ECQ. So it's something that's really not going to end up well as we see the numbers surge. I was hoping that this would have been kept for a while, that the extensive lockdown would have been kept for a while until the end of the month.
And Doctor, the Department of Health and health experts are saying it takes 1 to 2 weeks to see the impact of a hard lockdown. So does this mean the numbers can still rise over the next few weeks?
Yeah, it will rise because what we are seeing is the more transmissible Delta variant into play. So that's one thing that we have to remember, that this is a factor that was not seen in the second surge that we had. That's important to remember. And secondly is that with more cases that we see currently, and the cases are more seen in most of the households now, even children. We're seeing more kids with COVID. I think this is something that we need to take into perspective before we even say that the numbers will go down. We will need an extensive ECQ for a while. And besides, if you look at the current ECQ, it's really not one that is as hard as the initial ECQ, which we saw in March of last year, where mobility was almost zero.
That's true. Mobility was almost zero. There were the checkpoints were basically non-existent, especially the National Capital Region, despite the classification of ECQ. So the big question now is, Doctor, I mean, you serve in several hospitals. Until when can a healthcare system, including isolation facilities, handle this rising number of infections? Because if we are lagging 1 to 2 weeks in terms of numbers, this 17,000 is not the record high. It could be 20, 25, or even 30,000.
Yeah, and that's the prediction also of the health agency, that there will be increasing numbers in the coming months. And personally, I think it is a governmental decision on balancing the economy and the healthcare, but it's a very thin line, and it's something that the government will need to take into consideration in the next few weeks. Besides, it will be up to them also to change whether we will go back to another hard lockdown, but I don't think it is something possible. The mere fact that they let the ECQ go into a more lax category when the cases are even rising, this may not actually end very well.
Thank you so much for your insights on the situation. Infectious disease expert, Dr. Benjamin Ko.